Talk Radio 790 KBC, Peter Tilden Show. Continues, hour number 2. I'm just seeing breaking news. The GOP senators may give the accuser in the Kavanaugh case an option for a private hearing so she can testify in private. So that's the latest news. This is the KBC Impact Issues Forum. Today we're talking about California Prop 8, the limits of dialysis clinics. We have some no on Prop 8, folks. Kathy Fairbanks, a spokesperson, Dwayne Cox, who's a patient advocate and an actual patient. And yes, on Prop 8, Sean Worley and Magellan Hanford, who's also a registered nurse dialysis worker from Corona. Let me start with you guys first. And yes, on Prop 8, is this anecdotal evidence or is this quantitative and evidence of how bad or how good the system is? How do we, I mean, I hear the stories and I've read everything and it says cockroaches, there's some blood, there's this and that. But is this just anecdotal again, or do we have numbers about how widespread abuse is or lack of treatment? I know patients have to sit for X amount of hours, and one of the claims is they're rushing patients through, et cetera. How do you answer that?
Well, I mean, to speak to that issue, like I said, every clinic doesn't have those problems. Let's be fair, okay? But some clinics have been so problematic for so long that everyone in the system has come to accept it. Roaches being in the clinics, rats being in the clinics, blood stains on equipment and supplies. I can't get past this situation where they're saying they're going to have to close clinics. That's a false narrative. It's talking points. It's fear-mongering. I mean, DaVita's a Fortune 500 company, have been so for 12 years. They just committed $100 million to fight Prop 8. So if they're so poor, where does the money come from? How can they make $4 billion combined in profit? I mean, in 2017, DaVita was 179 on the Fortune 500. That means that you have to make over $4.2 billion to be on that. Their revenue was 16 plus million. They profited 663.6.
But just get back to the question: is there quantitative as far as cross dialysis clinics?
No.
About how many problems are, what the problems are, and how to remedy those. I mean, when somebody complains, they want a remedy. I'm guessing at a place. I'm sure they're whistleblowers. I'm sure they're patients talking about it.
Yeah, patients are talking about it. Workers are talking about it. Like I said, it's not issues that directly affect every clinic, but one clinic is one clinic too many.
All right.
Well, excuse me, but if it's one clinic, but this bill does not affect one clinic, it affects all of them in California. And as you have stated, this may be 1, 2, 3.
No. Put words in my mouth.
Wait a minute. No. You said you said it's not at all clinics.
I said it's not at all clinics. Exactly.
Right, so do you have on your? Do you have now? Does anybody have numbers about how many clinics are failing? To what degree they're failing?
No.
So we have no idea.
No.
But that's the thing, is that California itself has much higher outstanding outcomes than clinics around the country.
And how do we know that if we don't have the quantity?
There is data collected by the federal regulator, the Centers for Medicare and Medicaid Services. They rank dialysis facilities, dialysis clinics on the delivery of patient quality, 1 through 5 stars. California has more 4- and 5-star dialysis clinics in California than the national average.
But let me ask you, and then I'll give you guys plenty of time to answer to. How do you get remedy at this point? Because we know things aren't perfect. Let's assume again you want things to stay kind of as they are, and we know they're not hunky-dory assumed. So how do you make those changes?
Well, as a dialysis patient, it's super important to me to have high-quality care. And I know that I've been receiving that from my clinic. And I also travel a lot. And so I've been to clinics all over California and the rest of the country. And I have seen some wonderful treatments there. So this proposal is like taking a machete across the board to all clinics,
but there's
when what you might need is a scalpel.
Is there a mechanism for remedying at this point?
No.
All right, so let's go.
Right, but this bill doesn't do it.
This bill doesn't do it.
Well, this bill does do it for the simple fact that it will mandate that these clinics incentivize them to put money back into direct patient care.
No, it doesn't.
Hold on. I didn't interrupt you guys. Let me get my point in. Thank you, Mr. Cox. It makes them put money back into direct patient care. What does that include? That includes salary, wages, benefits, and it's non-managerial. It also mandates under the healthcare quality improvement costs. Those are the two areas that monies are put back into the clinics. that's going to support health information, technology, patient-centered education, and counseling.
So it is. So there are specifics.
Exactly.
No, there are not.
Read the prop.
Let's try and take a phone call real quick. Cecilia in North Hollywood. You're on Talk Radio 790 KBC. What do you want to say?
Hi, my name is Cecilia, and I was a caregiver for my parents who were both dialysis patients before they passed. And unfortunately, my oldest brother is now a patient too. So I strongly support this Proposition 8. These clinics are supposed to provide the best care possible. How is it that you are caring more for profit holders than your patients and workers? According to DaVita's website, they claim to be a community first, a company second, but yet their actions show profit-making first, patient care last.
Interesting. Okay, so how do you, and again, we're going to the other side of this point, the no. Go ahead.
I disagree with that. Look at the data. Look at the collection of data that's out there. California dialysis clinics are outperforming the national average when it comes to patient quality of care. The healthcare services received in the clinics, we're doing better than the national average. We have higher patient satisfaction scores than the national average. I mean, Dwayne can talk about this specifically in a sec, but I want to get back to what Magellan said. And there is nothing in Proposition 8 that says that the dialysis clinics have to spend or are incentivized to spend more on anything in the clinic. And if you think about how this will work, I mean, Sean and Magellan will acknowledge that under Proposition 8, the insurance companies are going to be paying less to dialysis clinics for the provision of dialysis services. How are the clinics going to spend more money on hiring more people if they are not making enough money to cover their costs? How are they going to spend less with...
Yeah, so if the industry right now says it costs $100 million a year to provide care, under this initiative, they could take $15 million above that in profit. The reality is that's not enough to provide the care that everyone deserves in California. So if they increased it to $200 million a year for providing care, they could take an additional 15% above that. So there's nothing capping the amount that they can spend on care. It's just saying that the beneficiary of that revenue should go toward the workers and the patients, not the shareholders. And this is something that the industry just doesn't want to do. That's why they're dropping $100 million into this campaign, because their shareholders are expecting a great return, and the patients are not the priority here.
I'm curious, who's funding the proposition?
Before we take a break, we only got two minutes. So you've been accused on your side that it's the SEIU, that's the unions that want to unionize the technicians and organize labor. How do you address that issue before we go out? And then
let me speak to that. First of all, SEIU did not come to workers. Workers came to SEIU. We were having challenges with patients dying in parking lots and bathrooms and within the clinics, and enough was enough. DaVita Fresenius would not address these issues. They would dance around them when workers would bring these issues up. They would not handle them directly. I've experienced where I've had to put a patient that died on the floor of the dialysis clinic in a dialysis chair and roll him into in a storage room and put him in a closet until I can contact his family and let them know that he died. These are the issues in dialysis. Patients are dying here in California, and DaVita and Fresenius do not want to do what's right.
All right, we'll take a break. I'll let you answer when we come back.
Okay.
And address, again, we're going out on the union issue. And the sponsorship issue is always fascinating for listeners and people who go to the voting booth and say, who's putting this up? Who's behind this and what's their intent? So that's an important thing. We can also say you can watch today's Impact Issues Forum live at facebook.com/KABC Radio if you want to do that. All the lines are lit, so I'll get to your calls next. Let them address after, of course, we come back and let Kathy answer that question. The phone number, 800-222-5222. Today's KBC Impact Issues Forum is about California Prop 8 limits on dialysis clinics. It's pretty heated because both sides are passionate about it, and we will take, like I said, we'll take your calls right after the news here on Talk Radio 790 KBC. Peter Tilden at 10 continues, Talk Radio 790 KBC. We're doing a KBC Impact Issues Forum. Today we're talking about California Prop 8, limits on dialysis clinics. And when we went to break, I was talking to Sean about the fact that claim is that the SEIU is trying to unionize the tech workers, and you started to give your answer on that, and I said Kathy can also answer and respond to that. However, on the no side, it's been pointed out that the two biggest groups are pouring a ton of money into this. The two biggest dialysis groups are pouring a ton of money into this. So if you can address those issues as far as support.
Well, let me back up and talk about the other groups that are opposed to Proposition 8. The California Medical Association, representing 43,000 physicians in California, is opposed because of the impact this is going to have on patients, the danger this is going to put patients in. American Nurses Association are opposed. Emergency room physicians are opposed and so are hospitals, because if clinics begin closing down, as we believe would happen under Proposition 8, patients will have nowhere to go except for the emergency room at hospitals in California, which are not equipped to provide dialysis care for thousands of patients, which are already overcrowded. And if dialysis patients show up there for care, it'll be far, far, far more costly. The state's independent legislative analysts pointed that out. We have dialysis patients like Dwayne who are opposed.
What percentage of dialysis patients go to either nonprofit clinics or to 911 emergency care? Do we know?
It's broken out. About 30% of patients in California get dialysis care at either the nonprofit clinics or independent.
And how do they operate?
The exact same way as everybody.
But they're doing a good job?
They're all doing a good job. The data bears that out. California's quality metrics show that patient quality care is better than the national average. And again, let me stress this one more time. Patient satisfaction scores, CMS sends out a questionnaire to every single dialysis patient in the country twice a year. They ask them, do you like your facility? Do you like your doctor? Do you like the staff? Do you think the operations are well run? All kinds of questions. This is all publicly available data for every single state. So you can compare California to the rest of the nation, state by state, or on a national average. And that's how we know we've got better scores. We have a 16% lower infection rate. The problem with 8 is that insurance companies are going to pay less. It won't allow clinics to cover their costs. They're going to have to shut down clinics, and patients won't have anywhere to go. They'll be more likely to miss appointments.
But to my question, you are supported primarily. The big money is by the two groups.
And we are supported.
Say yes.
Yes. And we're our side is also supported by more than 120 other groups representing the leaders in healthcare who are opposed to this because of the danger it's going to pose to patients.
All right, we're going to take some calls in a minute, but I want Sean and Magellan to be able to answer.
So it should be noted that the array of support is quite broad, everyone from health advocacy organizations, Latino groups, and the one that may stand out the most is the California firefighters. This is the largest group of firefighters in California. They are supporting Prop 8 because they know that the clinics owned by DaVita and Fresenius are not properly staffing, which leaves patients at risk of cardiac arrest, collapse. Magellan referenced some of that. And they know that each time they have to go and backfill for an industry that won't properly staff, that is time and money that could have been spent serving the needs of the community elsewhere. So basically what you've got here is an industry that is looking for taxpayer support because they choose not to invest in proper staffing.
Before we take the call, have these clinics been penalized? Have they been fined?
Oh,
have they been
Lord.
have any been shut down?
Yes. Can I go there?
Yeah.
Let me go there.
Real quick, and then we'll take the other side, and then we'll take the call.
Well, I don't know if it'll be quick because the simple fact, DaVita has been sued. You can go to DaVitaLawsuits.com and you'll find all the lawsuits. They recently just settled a case where they had false claims acts for their pharmacy. They paid out $63 million. They had a family lawsuit of $385 where three families, family members had died in the dialysis clinic. They paid out. Got a judgment for $383 million. There's another whistleblower for $400 million. Where a doctor and a nurse turned in DaVita.
All right, so let me have the other side address it.
I guess I would ask, number one, what does this have to do with Proposition 8? And number two, how is Proposition 8 going to address any of the things you just mentioned? Well, it won't. And that's why so many groups are opposed. And
who's funding Proposition 8? Who funds that?
It's speaking to the issue.
Answer the question.
That's the issue.
Hold on. Let me answer the question. First of all, these lawsuits speak to the character of DaVita. They've been sued over over billions of dollars because of patient issues. Just recently, even for Fresenius, they had a patient locked in the bathroom. Their daughter goes to look for her father, and where is he? 4 hours later, he's in a bathroom. The clinic's closed.
All right, let's take some calls because again,
let's do it.
And that's at
anecdotes.
One clinic. I'm sorry, just one thing, Peter. I am the one dialysis patient in this room. This affects me and it affects my life. As soon as I read this proposition, I was appalled and scared because dialysis clinics are our anchor.
No, Magellan
it's my anchor.
But Magellan is a dialysis patient also.
No,
right?
no,
I'm a
he's
nurse.
a
I give him the services that he needs.
I'm sorry.
I'm actually the patient.
So I obviously wouldn't be here trying to hurt this gentleman's care.
No, except that it does. This bill does hurt patient care. And no, that's not what they told me. I read. I am an intelligent human being, and I read this. I know what's in this bill, and I know that this bill could threaten my life and the life of other dialysis patients.
Let's take a break real quick. Let's try and get a couple phone calls in for the rest of the show. Lupe in Ventura. Good morning. What do you want to say?
Hi, my name's Lupe Tellez, and I'm a dialysis nurse from Ventura. I've been working 25 years in the industry. And I've seen we do not only have short staffing in these clinics. The staffing is severe. We don't have enough staff. Patient care technicians have to work up to 6 12-hour shifts in order to provide for their families because the wages are low.
Lupe, when you complain, what happens? When you complain, what happens, and who do you complain to?
Well, we tell the FAs and the managers, and they say, "I'm sorry, we don't have the money to hire more people." It's so bad that when people want to take vacation, the answer is, I'm sorry, can you find your own coverage? We don't have it, so you can't take your vacation whenever you want to take it.
All right,
so when the opposition says that they have no money, they have the money, they're getting it in their bonus, they just don't want to spend it.
All right, listen to me. We're going to take a brief break. When we come back, we'll address her issues. Because, again, my question is how on Prop 8, when you're limiting to a 15% profit, how does that incentivize somebody to do better care? And on the other side, with what happens if everything stays the same, and we know that everything is the way it is now? We're hearing there's flaws, and between the two sides, the one side is saying it's critical, we're critical with DEFCON 1, and the other side is saying no, there's good care. It's hard to as an outsider look at the system and say we're talking about two different ways to provide service. And again, I haven't seen anything quantitative. I haven't been able to find out. Yes, there are complaints, but I haven't seen how the complaints are handled, what they're doing with the complaints, and how you get a remedy. Like I said, if this does not go through, is there no remedy? We just stay the way we are. So we'll address more calls, and we'll address those issues when we return. We're doing the KBC Impact Issues Forum, California Prop 8 limits on dialysis clinics. We'll take more of your calls next. Today, we're talking about California Prop 8 limits on dialysis clinics. You can watch today's Impact Issues Forum, by the way, live at facebook.com/KABC Radio. We'll try and get some more calls and take this final segment here. Kathy Fairbanks is on No on Prop 8. Dwayne Cox, filmmaker, patient advocate, and dialysis patient, also No. And yes, Sean Worley and Magellan Hanford, who is a registered nurse and dialysis worker from Corona. We've got a big gap here. One side is saying that it's horrendous, the conditions are horrendous, which is why they're going for the prop. And the other side, they're saying, no, you get good care, and this prop would make it worse, okay? So let me get into a call here, but one of the claims was that patients are directed at these clinics to leave Medicare and Medicaid and sign up for private insurance because the clinics make more money. Again, how do you quantify that? How do you prove that? Let me start with yes, and then we'll go to...
Yeah, that's not related to Proposition 8.
But you did raise it earlier. You said that this was all about insurance. So let me explain a little. So
Speak to it, Sean.
The industry... They know their mission is to boost their profits. So for a patient who is currently covered with Medi-Cal or Medicare in California, their incentive is to switch them over to private insurance by paying for their premiums every month. And what that means is instead of getting paid $30,000 a year by the government, they can get paid upwards of $150,000 a year from your Blue Shield, your Kaiser Permanente, whoever your provider is. This is a huge thing for them. They pull in almost 3,000 patients a year just in California on this. That doesn't count all the other states. And as a result, they just keep putting up more and more money. The problem is when you talk to some of the patients and workers, you understand that over time, they have really cut back on services. One patient told me they used to provide a seat cover before they came in between patients. They no longer do that. Dialysis induces diarrhea. they used to actually provide an anti-diarrhea medication. They no longer do that. This is the small things that speak to the larger issue here, an industry that just doesn't value the patients.
All right, let Kathy address that.
And Dwayne can too, but I guess I keep going back to what I understand why the yes side likes to cloud the issues with things that are completely unrelated
as
to
you did at the beginning.
Because they are supporting a failed initiative that is going to harm patients, and they can't admit that.
Kathy, that's the only narrative that you guys have.
Let her finish her time.
Proposition 8 doesn't address any of that. It does cut payments from insurance companies. It allows the insurance companies to pay lower amounts to dialysis providers, and it's these lower amounts that are going to prevent clinics from covering their costs. The problem with that, as we keep getting back to, is that if clinics start closing down in California, which we believe is going to happen, in fact, the independent legislative analyst acknowledged that this is exactly what could happen, patients will be left without options to get dialysis. Now, the reason this is on the ballot in the first place is because SEIU-UHW, which is the group that Sean represents, has been looking to unionize dialysis workers for about 2 years. That effort has failed so far, and Dwayne can talk about what he's heard in the clinics. But instead of continuing to work with the employees and say, "Hey, you should join our union. Let's have a vote. Let's make this happen," they instead want to go around the workers with this Proposition 8. This is why every single editorial board in California that has evaluated Proposition 8 has recommended a no vote. The San Diego Union Tribune called it a cynical union power play. Other ed boards have said this doesn't belong on the ballot.
Because of time, let me give them 30 seconds to respond, and I want to get to the phones.
Let me speak to that. First of all, I want to unpack everything that she just said. First of all, like I said before, the union didn't come to us; workers came to them because we didn't have a voice in dialysis.
Then why haven't you?
Hold on, let me speak my piece, and then you can speak whatever you want to say. Secondly, Blue Shield put out a report stating that it takes 3,800 enrollees, meaning people paying their insurance premiums, to cover one dialysis patient. Why is that? That raises rates for everyone. DaVita and Fresenius receive taxpayer money, and they need to do right by the patients in the dialysis clinic.
And your initiative.
Hold on. Don't cut me off.
He said 30 seconds.
I thought he was finished.
If you can, wrap it up, and then we'll take your answer and go to the phones.
I do want to, I hear a lot about, we haven't talked about it much today, but one of their selling points for Proposition 8 is that it will lower healthcare costs, consumers are going to benefit, but actually there's nothing in Proposition 8 that says that insurance companies have to pass on any of the savings to patients. They could have written an initiative that required that, but they didn't.
All right, you know what? Let me take a call real quick. Emerson and San Bernardino, you have a question I think that both sides are capable of answering. What's your question? Emerson. Hello? Is he there? Emerson is not there. Emerson was going to. The question is, what's the difference in the industry in 2008 and now? How has it changed?
Well, for me, being in the industry, you used to have less patient care. You didn't have as many I've worked in clinics where I had to take care of 24 patients by myself, the only nurse in the clinic. I've had to come in and cover for nurses who had to leave the clinic, and I ended up taking care of 16 patients at one time. It's unimaginable.
I have never seen anything like that happen.
Well, that's
never
fine.
Once.
Well, let him.
That's fine, Dwayne. I mean.
Go ahead. Respond again, because we're going by. For me, it's stories. It's anecdotes.
Okay. And Dwayne, like I say, that's my truth.
I'll give you a
Hold on, Dwayne. It should be noted. It should be noted that Magellan has worked in.
Wait a minute,
Peter. Can we speak?
No.
Hold on.
No, let him answer.
Tell him how many clinics you've worked in Magellan, and then Dwayne can say how many clinics he's actually been in.
I've actually been in 12 clinics across the country.
Well, I've worked in over about 50.
That's fine.
I've
been in 12
clinics.
But it's my life that's on the line here. And
your life is perfectly safe, Dwayne.
No, it is not perfectly safe.
No, he's right. It's not safe in these clinics. They're so poorly staffed. How could he be safe?
Wait a minute. This bill threatens the opportunity for a lot of patients to go to dialysis and get dialysis care. I missed one session because I was traveling and my flight was canceled, and so I missed my dialysis session that day. That was a Friday. The next day, Saturday, I ended up in the emergency room because of heart problems because of missing my session. I ended up not only in the emergency room, but in the ICU because they did not know how to handle dialysis
All right, listen
patients.
To me. Let's go to Cassandra and Ventura again. For me, and as a listener, we're hearing again. It's informative, but it's anecdotal. And I don't know how widespread the numbers are. It's hard to discern just how critical or not critical the issue is. Let's go back to Cassandra and Ventura. Cassandra, what's your question?
So I just have a comment to make, and I just want to make 2 points as a nurse. As a nurse, I find this concept of rats and cockroaches running rampant in any clinic, let alone turning a blind eye to patients dying in bathrooms and parking lots, grossly offensive. No provider, let alone any family member, would just sit on the sidelines and volunteer themselves to live in a roach-infested or rat-infested environment. I've worked in several healthcare environments, whether it's academic, community, outpatient, inpatient, and we all know that any adverse occurrence such as this would require a root cause analysis to be conducted, and parameters would be put in place to prevent this from happening again. So with that said, I challenge all these cases of bloody deaths in bathrooms to have root cause analyses completed so that we can bring truth to the accusations.
All right, are there, again, we started this by saying quantitatively, how many of these happen and what's the remedy now?
The remedy now is people can file, there's the ESRD network where patients, their families, staffers can file complaints. You can file complaints to the state. You can file complaints to the federal government. These complaints are investigated, but again, so these are processes that are in place today. Proposition 8 doesn't change any of that. It doesn't augment it. It doesn't make that system better. It only takes away from patient care.
We only have 2 minutes left. Let me let you guys answer to that and address that.
Let me speak to that. The United States Renal Data System in 2016 surveyed by USRD. If you look on page 503, table 10.2, it found DaVita clinics had a higher mortality rate than hospital-based and DCI nonprofit.
Well, let me ask you a question though. If you move these two giant clinics out of that do 70%, what are the other 30% doing? Are they better, worse? And I keep hearing they're better than other states. Other states could be despicable, and better doesn't mean that much. So I can't compare. I don't have apples and oranges here, so it's hard to discern.
Every clinic has its issue. There's no perfect clinic, as the industry is presenting himself to be perfect, and there's no issues.
I don't think the industry is saying it's perfect.
Well, Dwayne, you said you've never had no issues, and that's fine.
I have never had that.
I'm saying,
but I'm saying
hold
that.
On, Dwayne, let me finish.
Once again, Dwayne, it's like taking a machete.
No,
a scalpel.
Let me finish up. You said that you're no problems at your clinic.
I haven't had those problems.
Let me finish up.
Here's the deal. We're at time. You guys can check in and get all the information from both sides. I'm sure you want to give out your email or where they can contact you or what your website.
Yeson8.com.
Yeson8.com. Easy.
NoProp8.com.
Pretty easy. So check it out. Go deep. Make a good incision. I hope we helped inform you to some point about the issue. And Dr. Drew is next with Lawrence Savon. Thanks for joining us. Thank you all for coming in and trying to keep it somewhat civil. Talk Radio 790 KBC.